Millions of people get treated for sports and recreation injuries each year.
Everything from muscle strains and sprains to broken bones and concussions.
Hi, I'm Dr. Ashwin Babu, a Mass General Brigham sports medicine doctor.
And I'm Dr. Michael Kolosky, a Mass General Brigham sports medicine orthopedic surgeon. We're here to talk about treatments for sports injuries.
Sports injuries are injuries to the musculoskeletal system, your muscles and bones, tendons, ligaments, and other tissue. Anyone can get a sports injury, from the highest level of professional and collegiate athletes to weekend warriors and people who don't get a lot of exercise.
Sports injuries can be acute, meaning they happen suddenly, like a broken bone, for instance. Chronic sports injuries develop and get worse over time, such as stress fractures and shin splints. Some of the most common injuries include knee injuries, including ACL tears, meniscus tears, and patella dislocations, hand and arm injuries, foot and ankle injuries, including Achilles strains and ruptures, shoulder injuries, including rotator cuff tears and shoulder dislocations, stress fractures and other overuse injuries, tendon strains and ligament sprains, and concussion. You should see a doctor if you have a head injury, experience severe pain and swelling, have pain or swelling that won't go away, or can't put weight or pressure on the injured area.
So, how do we diagnose sports injuries? A sports medicine doctor can assess your injury and determine the appropriate treatment plan. Your doctor will examine your injury and ask you about symptoms and how your injury occurred. We may use x-rays, MRIs, or other imaging to further assess the injury. An accurate diagnosis is critical for helping us determine the most effective treatment. So, what are the treatments for sports injuries? Treatments will depend on the type and severity of the injury. If you have a minor injury, the RICE method may help relieve pain and swelling. You can do this on your own at home. RICE stands for rest, to protect the injured area. Ice, or a cold pack, to reduce swelling and provide pain relief. Compression, where you wrap the injured area with an elastic bandage. And elevation, where you prop the injured area up above the level of your heart. Anti-inflammatory medicine like ibuprofen and naproxen may also relieve pain and inflammation. Other treatments include braces, casts, slings, or other equipment to support and protect the injured area. Massage and hydrotherapy to relieve pain and promote blood flow. Physical or occupational therapy to regain strength, ease pain, and restore range of motion. Steroid injections to decrease pain and inflammation. And regenerative medicine treatments like platelet-rich plasma, PRP, injections. Platelets contain hundreds of proteins called growth factors that play a role in the healing of injuries. Specialists isolate these platelets and inject billions into the target area.
What are the surgical treatments for sports injuries? Orthopedic surgeons can repair ACL tears, rotator cuff tears, fractured bones, and other serious injuries. Our surgeons use a variety of minimally invasive techniques. This type of surgery uses smaller incisions, which can mean quicker recovery and healing. Many people who have minimally invasive surgery for sports injuries can go home the same day. Occasionally, patients may need to stay in the hospital for a day or two. After returning home, you may need physical or occupational therapy.
A sports injury can disrupt your life, but here at Mass General Brigham, you will find medical and surgical sports medicine treatments tailored to your needs.
And with the right care, you'll get the support you need to recover and return to sports and all the other things you like to do.
Thanks for watching. I'm Dr. Ashwin Babu.
And I'm Dr. Michael Kolosky. To learn more about sports injuries, click here, and don't forget to subscribe.